And now we turn to our health news today. February is, of course, American Heart Month. And here to talk about what that means for you and especially the women in your life is Dr. Rachel Sosland, cardiologist with Menorah Medical Center. Thank you for stopping by this afternoon. I am so curious to find out more about what you were telling me regarding women's ability, or what should I say, their willingness to go and tell someone about uncomfortable feelings with their heart health and the difference that is from men.
Right, so absolutely. So unfortunately, women don't often understand the risk of heart disease, and over 300,000 women in the United States are diagnosed and die of heart disease every year. We often think of heart disease as being this disease of only older people, or we're not going to get it, we're young, we're healthy, we're fine. But unfortunately, over 4,000 women have heart attacks every year that are under 45 years old.
And they're less likely to go and talk to somebody about it, or less likely to go to the emergency room.
Because we don't always know our symptoms. We're not always aware of what's going to happen. We don't always hear what our symptoms are feeling. And so sometimes that's a little bit different than men and women. So men's symptoms typically can be just chest pain or pressure, and although women do have similar symptoms, it's often very different. It could be shortness of breath, it could be nausea or vomiting, indigestion, or even back pain, neck pain, jaw pain. But it's really important for women to watch their bodies and look out for symptoms that are different.
It really is. Yeah. And when I found out, well, we got Heart Month coming up, it kind of made me start thinking, you know what, I don't have any idea what's going on inside there. And now these cardio scans are available. I'm actually going to go get one tomorrow morning. I have an appointment tomorrow morning.
Great.
Does that show me, I know there's so much talk about this, the plaquing. What does that show, and how does that help us?
Right, so a calcium score is an x-ray. It's done on a CAT scan machine, takes just a few minutes, and what it does is it detects calcified plaque in the heart arteries before you may have symptoms. So it's a way to identify that plaque in patients that may have risk factors, so you can be properly treated and aggressively managed before you have symptoms to prevent a heart attack.
And I really love that this month kind of does force everyone to kind of take a different look at our heart health, especially for women. What do you see on the horizon as you know, exciting things that are coming up for cardiac care?
Right, so for women, there's a lot of new studies going on now, a lot of research going on with clinical trials and looking at different medicines for women and also treatments for women over time. A lot of our research and studies have been geared towards men, so now we're finding out, do women respond the same to medications as men do, or maybe differently? Maybe there's better treatments for women than men, and so the future looks bright. We have more and more treatment for women, and so it's very important that women get out there during Heart Month, know their risk factors, get seen by their physicians. You know, risk factors can be anything from smoking to diabetes to high blood pressure to high cholesterol and inactivity. So it's very important that people identify these risks and really get treated.
And not be afraid to just talk about it.
Right.
As women. I love that, Dr. Sosland.
Absolutely.
It's always a pleasure to chat with you.
Thank
you.
you.
More from HCA Midwest Health, go to kctv5.com/HCA Midwest.